As I told you before we went to the break, we'll be heading over to another community, a community called Agbekotsekpo, right here in the greater Accra region. And this place, it's actually very interesting with what's happening. So the community has actually been dependent on a health practitioner for 33 years for all their health concerns, and they have no facility such as a hospital or a CHIPS compound, but they've just been dependent on one person for all their health problems. I wonder how that person feels. I wonder what the person goes through every day if the whole community is dependent on this person. But anyway, we actually have a report on this story. Let us check out this report, and when we come back, we will have a conversation about it and maybe get to talk to this person.
Situated at the tail end of the Greater Accra region, the Agbekotsekpo township is a remote community whose residents primarily rely on farming for their livelihood. Meet Mr. KYT Abeco, the soul health practitioner who has dedicated the past 63 years to providing basic healthcare services to the people and neighboring communities.
Since 94. So 94 up to this time, I think it's about 31 years. Yes.
Wow.
If I'm not mistaken, 31 years. So I've been working as a TV agent, also trade me a health rep with primary health knowledge.
He recounts how the situation deteriorated over time, explaining that the lack of human resources within the local health system has left the community with no choice but to depend on his services alone.
I told them over here we have so many creeks around. When it rains, the road network, which tractors and others are slated for themselves, are being covered by water. And then in fact, if somebody is sick, which perhaps may need paracetamol or tricyclic tablet, that weighs the problem for him. You have to find ways and means traveling far to battle. And in fact, most of our people who have been dying out of some small sicknesses have been facing financial difficulties.
Access to adequate health infrastructure remains one of the biggest challenges for residents. Some community members emphasize how dire the situation is, noting that the construction of a health facility would significantly reduce transportation costs and improve the chances of receiving timely medical attention.
Wa feel difficult look was for hospital. Ke je here ke about the end of one distance in a very long. Lo wa pa pele for me awawo. Pele transportation ke je me simple wawo.
The assemblyman for Agbekotsekpo, Gershon Kwabla-Togbenu, urged authorities to fast-track the process to help address the pressing healthcare needs of the community.
Agbekotsekpo electoral area is zoned for a chief compound. But over the years, we don't have any chief compound that is to be zoned for. And we, as an assemblyman, I take it upon myself to echo and make sure that that kind of project have come to do that, to the light. So anytime I get opportunity at the assembly, you can imagine going to assembly and you don't have health facility. And then the well-being of the people must be your concern.
As part of its mission to raise awareness and improve access to healthcare, the LEM Foundation organized a health outreach in some of these underserved towns, including Tokpo and Agbekotsekpo. Supported by the Shai Osudoku District Assembly, the team provided a wide range of medical supplies and conducted several health screenings, such as blood pressure checks, malaria testing, breast cancer screening, and hepatitis testing, among others. The assemblyman further disclosed that this was the first time such an exercise had been undertaken in the community and expressed the assembly's openness to more of such impactful initiatives.
Health screening, I think, is one of the best of its kind. Ever since I was brought up here and I grew up in this community, we don't have any health screening in this community and any assembly member. So I think It's a part to my leadership and the good work of the Land Foundation for coming to our interview.
All right, so that's the report right there. And also, thank you and congratulations to the people that went there to
and
help
Jennifer
over
filed
the
that
weekend.
report.
Yeah.
Jennifer Nati of the City Newsroom. That's an interesting report, and to have a community where they rely on one person for over 30 years, really, and it's in the Greater Accra region. Really, there are communities really in this country.
Yeah, but we actually have Mr. Joseph Agbeko on the line, and he was the one that we just saw on the screen, and he was telling us everything that they have to go through, and he was talking about paracetamol, tetracycline, and all that. But let's get to talk to him and ask him what the situation is really like and what can be done about it. Hello, Mr. Agbeko.
Hello, I'm on air, please.
Yeah, how are you?
I'm doing well.
All right, so we want to say a very big thank you for being such a great help and a shoulder, for the community to actually lean on. It's not easy, but
I'm most welcome.
all right. So over these years, right, what kind of help have you been rendering to the community when it comes to their health? Is it herbal or orthodox medicine?
It's orthodox medicine.
Are you a doctor?
Yeah, I'm a health representative.
Okay. So you've been doing it for how long?
For about 31 years now.
31 years old. So as the community depends on you for everything concerning their health, what are some of the challenges that you actually have?
Not that they don't depend on me on everything. If I look at the condition, I make a referral to Toku or to Bato,
Right.
or to Doko.
All right. So
Toku and Bato.
all right. So Bato, Tokpo, and Dofo. How far is it from your own community?
About 6 miles.
6 miles. Right. Right. And your own community does not have any hospital.
Not at all.
Wow. And it's always been like this, or there was maybe a hospital and it was ill managed. Which one?
No.
Nothing at all.
Has been done.
Wow.
Wow. But this community is under the South Sudaku municipality, right?
Yes. I've been told they have one clinic at Doko, with the mileage radius, according to the health directive. They say the mileage radius covers here. So we're falling under the mileage radius within Doko clinic.
But it's far.
Which is far.
Wow. How many people reside in that community, the Agbekotsekpo area?
It's about 2,000.
2,000.
Yes, please.
And what has been the talks like? Since you are a health official, what has been the talks like when it comes to putting up a CHIPS compound, putting up a clinic or health facility for the 2,000 people in Agbekotsekpo?
We have land. I don't think with land there's any problem. But we finance, that is with the financial problems, personal problems.
Right.
I'm at an old age now, and I need somebody to be under me so that I train at least for the primary health care which I'm offering. But with the young ones, they are not prepared.
Right.
So health personnel are needed.
Right. But do you get paid for your services?
Hello.
Do you get paid for your services?
No, it's self-reliant. So no payment.
Wow. And when they come to you and maybe you have to administer some medicine, do you always have medicine readily available? Or because if they're not paying you, how are you getting the medicine?
I try to liaise with some of the pharmacies, and they are helping me.
Wow.
What are some of the issues that the residents come to you with? Is it headache, is it stomach ache, maybe pregnant women? What exactly is the issue that
malaria, pregnant women, stomach, like diarrhea and others.
And you are able to treat them?
Oh, sure. By the grace of the Lord.
Right. Mr. Agbeko. Yeah.
Yeah.
Oh, no, you can talk.
Yeah, I was trained for that. I was trained by our district health team.
Oh, you were trained by the district health team?
Yes, please.
So if you were trained by the district health team, why haven't they established any chief's compound or brought any facility to the community?
Yes. Oh, yes. It's what we've been talking about. Last year like this, they made an attempt to do that, but I don't know why they couldn't tell us anything at all.
And did you follow up?
In the pipeline.
Did you follow up?
Oh no, but this time I'm arranging with the assembly member so that we put things through writing.
Right.
Has your member of parliament, who is the Greater Accra Regional Minister, Linda Akwele-Oklu, been to the community yet?
Oh, Linda Oklu matter, in fact, it shouldn't be like political. You will not see her. She only come here once in a while.
Come again with that. I didn't hear you.
I said that you will not see Oklu.
Oh, she doesn't come there.
It's only when time is closer to politics before you see her.
But has the assembly member tried calling her or maybe dealing with the municipal chief executive for the area in the past to get a health facility in the community?
Oh, assembly member has been doing that.
But have you also tried asking Linda, why she hasn't been to the community? Maybe asking the assembly member why your member of parliament has not come there yet.
Oh, for the past years, I have not done that. But I'm now liaising with the assemblyman so that we could put things into writing and pass it, give it an onward transmission to the district as well as the region.
All right, Mr. Agbeko, how are you?
I'm doing well.
Yeah, and I must say you are doing a great job. Clearly, you are not that young again, but how do you take care of yourself? Because like this is a lot sometimes.
Sure.
So how do you take care of yourself? Do you also? I'm sure you also get tired. You also get sick. So how do you take care of yourself?
If I have minor cases, then I visit my people at the chief compound Topo. But when I see that is serious, I go to Adan.
Right.
Adan District Health Center.
Right. And your name is Agbeko, and this place is Agbekotsekpo.
Yes.
Are you the owner of the town?
Was it named after you?
It was named after my grandfather.
Right. Great.
Okay, so let me find out from you. You just made mention that you yourself, you attend some health facilities or some health centers when you are sick. Can't the residents also go to those same places?
Oh, pardon, come back again.
You said that if you are ill or you are sick, you go to some health centers, and you made mention of them. Isn't it prudent that the residents of Agbekotsekpo will also go to the same place, or is there a challenge when they should go to that particular health facility?
Oh, no, they also do go.
But it's far.
Tukpu and Dofo, which is far.
Yeah.
Okay, Mr. Agbeko, thank you so much for your time.
Thank you so much, Mr. Agbeko. I think you're really doing a good job. Thank you. And we need more people like you. We appreciate you for all that you are doing. Thank you so much.
I like something that he said. He says that he's getting old and that he would want the young
train
ones
people, but there are no people to
I
train.
think that if they can get a chips compound, maybe they should.
That will help.
It's in a greater courage, at least sort of serving like a first aid services for them before they would go to the bigger health facilities.
It must be very tiring for him.
If not for this report, I didn't know there was a community called Agbekotsekpo. And this community, it's in the Shire Osu Duku municipality, or is it district or constituency? And from the way things are going, they are saying that they hardly see the member of parliament. Maybe when I get close to Malinda, I'll ask her, oh, your constituency, Agbekotsekpo. And I think there's a Sanders area, his constituency too. Maybe I'll speak to Sander and ask him what he knows of the Agbekotsekpo area, among other things. But I think that Mr. Agbeko is doing a good job if really he has taken this upon himself.
His grandfather will be proud.
Yeah, to help his residents with malaria by giving them some. But I think it should be checked. You understand? It should be checked. So
because he's getting older too. We cannot take that away from him. But he's getting older, so
if the various authorities are watching, maybe they would want to contact him and see what they can do for
him,
the community members.
And I think not just authorities too. I think any company, anybody that wants to help. If you think you have some CSRs, this is a very important cause that you should think of investing into or donating into, because the people out there actually do need help, and one person carrying that on his shoulder, I mean, he's done well. So it's great to help.
So we tell the story here to empower the change that is needed in the various communities, and that is why you would want to stay with us here on ChannelOne TV.